Hi, my name is Dr. Cozy, and really quickly, can I just get you to verify for me your name and date of birth? Good. Do you know where you are? Okay. Do you know today's date? Good. All right. Okay. So you've been experiencing some nausea, fever, and headache. Okay. If you were to rate the pain level of your headache on a scale of 1 to 10, 1 being pretty minor, 10 being absolutely excruciating, how would you rate that? Okay. And did the pain of the headache come on suddenly? Did it gradually build up? Okay. You're not sure. Is it just in your head? Is there any kind of like radiation down your spine into your neck? Okay. And can you point to me on your head where you're feeling it? Okay. Is the pain constant? Is the pain constant? Is it like a throbbing or kind of like an ice pick headache where it kind of feels like something's stabbing into your head and then it eases up and then it starts again? Okay. I just want to take your temperature really quickly, okay? So if you can open your mouth for me. Perfect. And then lift up your tongue. Okay. Put your tongue back down and close your mouth. Okay. You can open. So you do have a pretty high temp at 103.2. Is that about where you've been measuring your temperature? Okay. So, is it okay if I touch you? Thank you. So this is where you're feeling the pain. Okay. Are you having any kind of double vision? How about any confusion, difficulty with speaking? Okay. Have you hit your head recently? Okay. Any travel outside of the country in the last 6 months? How about any exposure to farm animals? Any ringing in your ears or lights in your vision? Okay. How about neck stiffness? Any back pain? Can I have you smile for me? Just a really big, cheesy grin. Thanks. Hold that. Okay. Now let's have you frown, so really dramatically furrow your brows. and neutral expression. Okay. Can I have you hold your arms out in front of you, kind of like you're sleepwalking? Thanks. Okay. Good. And just get this out of the way here. Okay. I want you to push against my hands, okay? Good. And now keep your hands up just like that. Don't let me pull them towards me. Good. Okay. You can relax. Did that cause any kind of pain or discomfort or anything? Okay. In terms of the nausea, the fever that went along with the headache, did all of those symptoms start at the same time? Okay. Do you have any history of any herpes simplex virus or even chickenpox, shingles? Okay. Okay. Have you vomited? All right. And any shortness of breath, heart palpitations, chest pain? Any joint pain? Okay. Any rashes, hives, other raised skin? Okay. Okay. So I'd like you to do your best to keep your eyes open. I know with the bright light it can be a little tricky. It's okay if you need to blink, but do your best. And if you can focus your gaze right there, right in between my eyebrows. Good. Okay. Sorry, that was kind of an awkward one. Okay. Keep gazing straight ahead. Okay. Other side. Okay. Now keeping your head still, so I just want you tracking my light with your eyes. I want you to follow my light. So I'm going to go pretty slowly, don't worry. You know what? If you don't want to fit, we'll just keep you here. Okay. I'm going to take a closer look at the inside of your eyes using a fundoscope. So, again, do your best to keep your eye open. Are you able to feel that? How about there? Let's try that again, okay? So it's a bit muted. You feel it less than you felt on that side? Okay. How about right there? There. And on your nose. Okay, so it's really this right side. Can you feel up here? How about down here? Okay. I'm going to step out for just a moment. I'm going to call neurology and request a neuro consult, as well as put in some orders for some imaging. I'd like to get a head CT, an angiogram, and also some imaging of your neck as well. So it should just be a couple of minutes. This is Dr. Cozy. Yeah. emergency room. We're in Bay 2, and they've presented with headache, nausea, as well as elevated fever to 103.2 Fahrenheit. Upon exam, I am noticing some facial numbness. Is it possible to come down here for a consult? Okay. About how long? Okay. Then I will make a point to get their imaging done first. Okay. Yeah, I just sent the notes. Okay, thanks. Okay, so we're going to get radiology done first, okay? And then neurology will come down and do a consult right here. That should be within the next couple of hours. So we're gonna, again, make sure that your imaging is done first, which will actually be more helpful because then they'll be able to see a complete picture and better help you. In the meantime, I'll listen to your chest, okay? Can I have you take a deep breath in and out for me? Hey. Hey, wake up. Wake up. Hey, welcome back. You were lights out there for a second. Yeah. Really quickly, focus right here in between my eyebrows again, okay? Do you remember what you were feeling? Were you feeling lightheaded, nauseated, or anything before you passed out? Not sure. Okay. I'm gonna finish your chest exam really quickly here, okay? Because I want to rule out any kind of cardiac abnormality. And then I'm gonna put some leads on your head so we can monitor your brain activity. So. Deep breath in and out for me, please. Good. And again. Again. One more time. Okay. I'm gonna listen to your carotid. So can I have you take a deep breath in and hold it? And breathe out. Okay. And again, deep breath in and hold. And breathe out. Right. I'm going to check your temporal pulses. Okay. Nice and equal. Jaw feels okay too. Okay. One more thing I want to do before we do that, which is I want to just check your airway and the inside of your mouth. If I can have you open for me again. Thank you. Okay. Oral pharynx is clear. Don't see any tonsillar swelling or irritation in the throat. Alright, I'm going to remove my tongue depressor. Just keep your mouth open. Actually, I'm going to use this again, sorry. Just so I can kind of move your cheek here. Okay, buccal mucosa looks okay on that side. That looks okay too. And if I can have you lift up your tongue. Alright, you can close your mouth. Okay, let me grab my ruler back. I'm going to start by taking some measurements. And I have a little makeup pencil I'm going to use to make some marks so I know where our leads need to go. So, right in the midline. Okay. I'm going to be placing these little stickers on here right where I made those marks. Can you hear me? Hey. Hey. Hey, welcome back. We lost you again there. Unfortunately, I hadn't finished putting on our electrodes, so we didn't have any way of seeing your brain activity. Not your fault, don't worry. But we need to get those on. So again, focus right here, okay? Okay. Alright, well, your pupils are equal and reactive. So that's good. So, okay. As we were, I want to make sure that we get these on you before we continue with our exam, because if that happens again, I want to see what's going on. Okay. Sure, we're all nice and straightened out here. Sorry, I just want to make sure that our wire doesn't have any kind of kinks in it. And I'm also going to stick a pulse ox clip on you. So this guy just clips on a finger, just like that. Do you have a preference? So if at any point you feel like you might need that taped on, because some people have a hard time, especially if your hands tend to sweat, keeping it in place, it's really important that our sensors stay put because I don't want any kind of false readings. If you keep on losing consciousness, we don't want to miss anything that could indicate the cause. So, do you think that it would be better if I taped it? Yeah, I can do that. Not a problem. Okay. All right. All good. So, okay. Just had to check where we were. I'm going to take a look at your ears. I don't think that there's any kind of ear infection causing this, but we like to be pretty thorough. Especially because sometimes the body can surprise us and do some interesting things. So, right. Alright, is this okay? Is there any kind of discomfort or tenderness? Okay. Oh, this ear looks good. Nice and clear. I don't see any fluid or inflammation present. Check the other one. Alright, is this side okay? This side looks good too. Also no evidence of fluid or inflammation. Keep your ears nice and clean. Switch that out for a new one. And I'm just going to take a peek inside of your nostrils. So, okay. Great. All right. So, I'm going to gently, because you have the leads attached to you, turn your head from side to side while kind of doing some intense eye contact. I'm looking for something called nystagmus, which is when your eyes kind of flicker. It can indicate a loss of balance. I didn't see any fluid in your ears, but if there's deeper fluid in, I'd like to know. And also sometimes nystagmus can indicate other pathologies. So I'm just going to very lightly place my hands here. Okay. Okay. Any dizziness? How about now? Okay. We're going to do one more time. Okay. How was that? And any neck stiffness? Okay. Did that change the headache at all? Okay. Hey, welcome back. Yep, you lost consciousness again. I didn't see any change in the reading on your EEG. So, but maybe neurology will know to look for something different that I'm just not seasoned in neurology to look for. Focus your gaze right here again. Yeah, we're gonna need to do this every time because I want to make sure we don't miss anything. Sometimes things can present after a while. Okay. Tell me when you see my light enter your field of vision. Okay. And again. Okay. Keeping your head still, follow my light. Sorry, there's a nose whistle I could hear. Okay. I'm going to take a quick peek inside of your eyes again. Sometimes if there's a certain kind of swelling, we can see through your eyes. So. Okay. Okay, not seeing any papilledema, which is a good thing, but it also, means that we still don't have any answers. I'm going to palpate your neck, so please let me know if you feel any kind of stiffness, discomfort, anything just feels off, or if anywhere triggers more headache. Any discomfort or pain in any of those areas? Okay. How's your head feeling? Okay. So no change. I'm sorry. One more question. Did you have full sensation when I was palpating your neck? You felt everywhere? Okay. Just wanted to check. gonna check your reflexes here, okay? Mm-hmm. All right. Reflexes all look good. Okay. Now I'm just going to be feeling your arms. Hey. Come on. Try to stay focused on me. Hey. Welcome back. Yeah, it happened again. You know the drill. Focus right here. Well, your pupils are still equal and responsive, so that's good. Alright, transpo here, ready to take a patient up to radiology. Great, thank you. Okay, so you heard that. Transpo is here. They are going to take you to radiology so we can get that imaging done, and then I'm going to actually reach back out to neuro, see if we can have them meet you. I want to move you to the ICU, so that way we have people around to observe you and not miss anything. Most likely, yeah, you're going to be staying here overnight, because with something like this, we really want to make sure that we keep you stable, that you're okay, and that if something is happening, that you're here where people can catch it and help you right away. Okay? Okay. Yes, I will still be checking in on you. But in the meantime, if in fact you do lose consciousness in radiology or on the way, there are also trained health professionals everywhere who are going to be able to help you. Okay? Okay. So, yep, come on in. I'll see you upstairs.